Hi, I'm Dr. Joe Niamtu, and we're going to make a little video for MakeMeHeal.com. And today we're going to look at Midface Rejuvenation with injectable fillers. I'm Dr. Joe Niamtu, LoveThatFace.com. We're going to talk to Cindy here today about midfacial rejuvenation with minimally invasive techniques, and probably we're going to do some filler in the cheeks and tear troughs and a little bit of Botox. And a lot of people don't really understand, a lot of patients and unfortunately a lot of doctors, the kind of the dynamics of midfacial aging. So if you smile, Cindy, when we're young we have this volume here, relax, and it holds everything up, and now just totally relax. And as we age we get drawn here. And so you know, I did 71 facelifts last year, and I put a lot of time and energy into making the lower face look better, which we'll get to on Cindy sometime. But right now we're just looking at the mid face. So there's a couple things that most of us have as we age, and we start to kind of lose our fullness in this little teardrop area here on both sides. And so we have this little groove. Now this is not the nasojugal groove, this is not the tear trough, but it actually is confluent with the tear trough. So look up at the ceiling for me once. So we have kind of these two areas, and they both look a little bit like teardrops or that type of configuration. And by putting some filler here and here and here and here, we can rejuvenate that part of the midface. And again, youthful faces have fullness and curvature here. We could also do cheek implants, but today we're exploring minimally invasive. A little bit of local anesthesia on 100% of my patients. I know a lot of people don't, but I've taken a lot of business from competitors that hurt patients. So I'm really fussy about having people numb. This is a little vibrator from Blaine Labs, and it's a convenient little thing which I really think takes a lot of the pain away from injections. And I'm just going to put a little bit of 2% xylocaine, 100,000 epinephrine under the tissue here. It doesn't take much, and it's just enough to take a little bit of the sting out of the filler. And we'll let that set for a couple. We've waited a couple minutes here. We've got a little blanching. So I am going to be probably in the subcutaneous plane. We happen to be using Perlane here. I like this filler because it's got a pretty good viscosity, or G prime, and it tends to lift tissues nicely, but I could very easily use Radiesse or Juvederm Ultra Plus here as well. And no real magic to this, just kind of filling in this little teardrop that I drew. And my assistant put a little bit of Vaseline on there, and I think massage is extremely important when treating filler in any area. I think a lot of people overlook that and they get a lumpy result. So we're just massaging that. Now, when a lot of people learn tear trough injection, they inject right in the tear trough to the infraorbital rim. And you know, really that's not a friendly area to inject. Very thin skin, very vascular, and I think the bruising is a lot more prevalent there. So what I like to do is come in below the tear trough from the cheek and then get up to the orbital rim. And you can actually inject a little bit more superficial here, as long as you're under the orbicularis muscle. The other nice thing about this approach is you can do it with a single puncture and not have to do multiple punctures. And we always want to inject slowly with small injection pressure. And then again, I can massage this filler to the right and to the left and to distribute it where I want. And you can see that's already looking so much better. So again, I'm coming from a lot lower on the cheek, and this has really improved my result, decreased my bruising, and I have to be honest with you, I wasn't a big fan of tear trough fillers. I did a bunch of them, but I really didn't like it. But I really enjoy doing it now, and I think that this approach has made a difference. I'm going to get a little bit here, She's got a little bit of a lateral fat pad, and we're going to try and blend that in. And again, that massage is very important in moving the filler around. So you can see how this area is really starting to fill out nicely. Now I'm going to put this filler a little bit more superficial here. Okay, so that's we're going to go to the second side. And again, I'm going to get right kind of in the depth of this little cheek trough, unlike the tear trough. I'm not referring to this as the nasojugal fold. And I'm going to inject a little deeper. You can inject it superficially, but I like to layer it. But I really think you need some deep injection for support here. And then we'll get some lubrication on this. Now I'll go a little bit more superficial, and this allows me to contour this almost topographically. If you're familiar with a topographic map where you have concentrically decreasing circles, that's kind of what I think about when I do layered filler. And now we're going to hit this tear trough a little bit, and again, I'm coming from low on the cheek. I'm in the region of the orbital rim, but probably a little bit more superficial, and I'm probably still under the orbicularis oculi muscle. And I just don't get bruising when I go this way. Now some injectors go from the inside of the mouth, but I still like going through the skin with a little bit of local anesthesia. And I'm going to sneak up here and get a little bit of filler right in there. And my last little bit right in this depression. And I'll come over here now and massage this a little bit more. And you know, the unfortunate thing about fillers are the expense. I could easily put another 1 or 2 syringes in here, and now we've got a little bit of edema here. But hopefully you can see the difference. Open your eyes a second. Look up over your head once. So you can see the tear troughs are less accentuated, and the cheeks are more filled. Thank you.